What's up, everyone? My name's Dr. Lance Frank, and I'm a pelvic health physical therapist. Today, we're going to be going over a hip mobility flow. I give this to a lot of my patients in the clinic, and this can be used for a lot of different diagnoses. We have pelvic pain, we have urinary urgency, frequency. The whole goal is to try to relax all of the muscles in the pelvis and get a little bit more mobility through them. So, let's get started. So first up, we're going to start just with a standing forward fold. So you're just going to bend over, try to touch the floor, keep your legs straight, and try to shift your hips all the way back. Try to sit your weight into your heels and shift your hips all the way back as far as you can, trying to stick your butt out. If you can't touch the ground, just bring your hands up to your shins or even up to your knees. The goal is to keep your knees locked out straight. You're going to hang out here 10, 20 seconds, and then you're going to shift your weight. You're going to bend one knee slightly, and you're going to shift your weight over the leg that you kept straight. And then you're going to try to shift your weight and shift your hips onto the stance leg so that you get a pull all throughout the glute that you're standing on. So on this side, you're going to shift your weight over. I've bent my left knee, my right leg is straight. I'm shifting my weight through my right hip to get a stretch all throughout my glutes, down into my leg and into my calf. So you're going to shift your weight from side to side a couple times, get a nice stretch through there, and then go back to center. Let your head hang heavy. And then here, I like to spread my feet just a little bit, and I like to do a little deep squat. So I just like to hang out here, open up the pelvis, make some room in the pelvic floor. You can even use your elbows to pry your knees out to the side a little bit if you can tolerate it. You should feel a big stretch in the inside of your thighs and your groin. And then you come back up, do another little stretch, and then from here, you're gonna walk your hands out into this bear crawl position or downward dog, but you're gonna keep your legs straight. So we're gonna go into a calf stretch. So shift all your weight onto one foot, keep your knees straight. You should feel a big stretch all the way from your glutes, through the back of your thighs, down into your calf, maybe even into your foot. So hang out here for 10 to 20 seconds, and then shift weight onto the other leg. Do the exact same thing. Keep your knees straight, put all of your weight through the back of your heel, press up through your hips, and you should feel a big pull into your left glute, down the back of your left leg, into your calf, almost into your feet. So then you'll bring both feet together, again on the ground, press up into a downward dog. Get a nice stretch in the low back, the mid back, in the lats. And then from here, go into cobra. So you're trying to keep your chest up tall, letting your glutes relax. You should be feeling a big stretch in the front of your abdomen and into the hip flexors. And then from here, I like to do a little rotation. So you'll rotate from side to side, letting your hips stay in contact with the floor. Just do as gentle rotation as much as you can to get a nice stretch into those hip flexors. And then come back to center. Try to look up towards the ceiling. Get a nice stretch in your chest and in the lower abdomen. And then from here, sit your butt back into child's pose. So you'll separate your knees a little bit, bring your feet together, and sit your butt back towards your heels. So here you're just relaxing. Take a few deep breaths. Think about breathing all of that air into your pelvic floor. Breathe into your pelvic floor, trying to relax all of the tissue. Think about widening your sit bones as you inhale. And then from here, you can do a little rotation. So one arm is going to stay straight, and you're going to rotate. So right now, my right arm is staying in contact with the floor, and I'm rotating to the left. You should feel a big stretch underneath your armpit. So right now, I feel a stretch underneath my right armpit and in my right lats. So again, rotate to the left side, keep the left arm in contact with the floor. Now I'm rotating to the right. Feeling a stretch underneath my left armpit into my left lats. And then come back to center. And then bring your knees together. And we're gonna bring one leg up in front into a runner's lunge. So here, keep your hands on the inside of your foot. And I like to do a little weight shift. So you're gonna shift your weight from side to side. You should feel a big stretch on the inside of your thigh, on your left leg in this position, and in the front of your hip, your right hip, and your hip flexors. From here, you're gonna do a little rotation. So we're gonna work the mid-spine. So you're gonna take your inside hand and rotate up towards the ceiling as far as you can. Come back down, thread the needle, rotate back up. Come back down, thread the needle, do one more, reach up. You can put your hand behind your back and use this as a lever to pull deeper into this rotation. And then come back around, connect with the floor. And then we're gonna go into lizard. So you're gonna try to get your elbows to touch the floor as far as you can. If you wanna do a little tricep push-up in this position, go right ahead. You're just keeping your hands in contact with the floor and bending at your elbows. And then come back up. And then from here, I like to sit back into a hamstring stretch. So you're thinking about keeping your hips level, facing the wall and directly in front of you. So you're not rotating. You want to try to keep your hips square with your leg perpendicular to your body. So from here, you're just going to bend over as far as you can. You're going to hold this position for a minute or two, 10 to 20 seconds rather. And then you can go into a sciatic nerve floss. So we're literally going to floss your nerve. This is great for people that have a lot of neural tension or a lot of sciatica pain or low back pain or pain that goes down your leg. So you're just going to move your ankle. So you're going to point it towards the opposite wall and then point it back, pull it back towards your face. And then point and then pull it back. So you can rock between this position a couple different times, and then you'll come back. And now, and if you need, grab a pillow, or if you have a pad, because sometimes this doesn't feel great on your knees, but we're gonna go into a hip flexor or a quad stretch. So from here, you're gonna pull your foot up towards your butt. Once you balance yourself, think about sinking into this stretch. You don't want to arch your low back too much because we want the stretch to be in the front of your glute. So you're going to come up here, think about squeezing that right glute, squeeze that right butt cheek, to shift your hips forwards. So you should feel in this position a big stretch in the front of your hip, maybe even down into the quad. Those are the muscles we're addressing. So hold this stretch for a little bit and then come out of it. So from here, you're gonna rotate to the front. This leg is gonna be directly out to the side. And you're gonna sit your butt back towards your heel. So my right knee is bent, I'm sitting on my right foot, my left leg is extended out to the side. So from here, you should feel a big stretch on the inside of your groin, inside of your thigh. So think about sitting your butt back, getting a nice stretch. And then you're gonna rotate again. So you're gonna spin on this knee into pigeon. So the foot comes under, left leg is still extended behind. With this, we're gonna feel a big stretch. You should feel a big stretch. In this position, my right hip is the side I'm stretching. So I like to shift my weight in my hip joint from side to side to feel a big stretch throughout. You're gonna hold this position for a bit. And then, when you come out of it, you're gonna go into that 90-90 position. So one knee 90 degrees in front of you, the other knee is 90 degrees out to the side. From here, you're just gonna bring your hands behind your hips and feel a big stretch. You may feel it in the front of your hip. You should also feel it in the back of your glute. So for me, in this position, I feel a big stretch in the outside of my left glute and then in the front of my left hip. We're targeting the TFL, tiny little muscle in the front of your hip, and we're also targeting your obturator internus and deep inside your hip. From here, you can do a couple knee lifts. Try to lift the knee that's out to the side. We're trying to work those muscles in there, trying to get them to loosen up. And then from here, you're just gonna rotate to the opposite side. So you're gonna do a little windshield wiper mechanism and then rotate. So now my left leg is bent at a 90 degree in front of me. My right leg is bent at a 90 degree out to the side. So we're gonna repeat that entire sequence in reverse. So now, put your hands behind your hips. You should feel a big stretch on the inside, the front of your right hip now, and in the back of your left hip, of your right hip. So that right TFL and that right obturator internus. You can do a couple knee lifts to work that obturator internus. So you're trying to lift that right knee up towards the ceiling. You should feel a burn on the outside of your right hip. And then from here, you can grab your pad again, or your pillow, whatever you need. Put it underneath your knee. And you're gonna go into pigeon. So we've just rotated to the left. We're gonna repeat all of these stretches on the left hip now. So again, shift your weight from side to side. Try to sit down into that hip socket to get a nice stretch. Lean to try to shift your hips into that hip joint. And then we're gonna rotate into this adductor stretch. So right leg is extended out to the side, left knee is bent, sitting back on my left heel, trying to feel a stretch on the inside of your right thigh, into those adductors. You can stay up here on your hands. You can go down to your elbows and try to just relax into this stretch. You should feel a big stretch all the way up into the perineum, into the pelvic floor, possibly down into the inside of the knee as well. So from here, we're just gonna rotate again. Right leg stays extended. We're gonna go into that hamstring stretch. So from here, again, thinking about keeping the hips level. Right leg is perpendicular in front of us, and you're just bending over as far as you can. So you're gonna feel a big stretch behind the right thigh and the right calf. And then we're gonna go into that sciatic nerve floss again. So you're just gonna pump your ankle, point it towards the front of the room, and then pull it back towards your face. With your toe pointed, it's more of a muscular stretch. You should feel this behind the calf, into the hamstring, maybe even up into the glutes. But with your toes pointed towards your face, it becomes more of a nerve stretch, a neural stretch. So pump in between those two positions, and then we're gonna come back up into that quad stretch. Pull your foot towards your butt. Once you get your balance, think about squeezing that left glute and shifting your hips forwards. So again, you should feel a big stretch in the front of your hip and in the front of your left thigh into that quad. This is a quad and a hip flexor stretch. And then from here, we're gonna go into that lizard position, or that runner's lunge rather. So you're gonna be here. And again, think about shifting your hips from side to side. Think about squeezing that left glute to get a nice stretch on the inside of the front hip. And then we can go into that lizard twist or thoracic rotation. So you're just rotating that inside arm up towards the ceiling as far as you can, and then coming back down. Thread the needle, get some nice rotation in there, come back up, back down, and we'll do one more. Rotate up. You can put your hand behind your back again. Use your hips to pry your chest open, and then come back down. From here, you'll go into lizard. So think about keeping your hands planted in front of you and just bending at the elbows to try to bring your elbows down to the floor as far as you can. So kind of pulse in and out of that position, get a nice stretch. You should feel a big stretch in the inside of your right thigh in this position, the front of your left hip in this position. And then you'll come out of it. And that's it, you made it. I hope this flow works well for you. I give this flow a lot to a lot of my patients to just take decreased tension throughout the pelvic floor. Follow along for more.